Hello, my friends. Welcome to the Running for Real podcast on this special report episode. I've been trying to think about what to call this. It's a bit of a weird situation, but as is everything right now. Thank you so much for listening today. This is, don't want to say this is exciting to have you because it's definitely not necessarily a good reason, but I wanted to do something for us to refer to. There's so much information out there. So much of it is contradicting. Things are getting misinterpreted, lost in translation. We don't know what to do. Of course, we're panicked. Of course, we're scared. Of course, we're snappy. And yes, many of you I know are quite upset about missing races, and that's completely understandable. And no one really knows what the answer is, what's going to happen. But I want to thank Steph Zwicker for suggesting this episode to me and for introducing me to my guest today to make this possible. Also a shout out to Mama Docs Run This community for being the reason Steph knew Emily and for helping me in many other ways in my life. So there's no ads, no breaks. I'm not even going to pause. Emily is here right now. She can hear me saying this to you. This is just going to be information, your questions that you've given me. It's 6 a.m. It's 6:02 a.m. Well, where I am. Emily, I'm assuming it's 7 for you. And we are getting this in before Emily has what I'm sure will be another crazy day. So I asked you for questions. We're going to answer those questions. And at the end of the chat, I'm going to kind of talk a bit more about what to do if your race has been cancelled, what to do if your race has been postponed. So I'm going to give you more of the running end of it. But Emily, I wanted us to have the actual questions about what this is, what's going on, and yes, some related to our running. So Emily, thank you so much for being here today. I can only imagine how busy you are right now. So thank you for giving us some time and helping us to kind of calm our panic a bit.
Yes, it's great to be here. Thank you for having me.
No, I don't want to say I'm excited because I would rather not have this conversation with you, but I'm excited that I get a new friend to kind of meet and get to know in the future. So tell the listeners and I, what is it you do?
Yeah, so I am an infectious diseases physician. So I primarily take care of patients who have infections. I also work as an epidemiologist. And so pandemics are kind of my thing, I guess. And I am also the medical director of our occupational health program at the University of Michigan. And it is my job to keep our workforce members here, all of our physicians, nurses, et cetera, to keep them safe.
Mm-hmm. And that sounds like all three of those roles that you have, each of those play into what is going on right now. So I can only imagine how many meetings you're getting pulled into and things you're having to be doing all day. So once again, thank you for this. But tell us, what have your days looked like this week?
Yeah, so as I'm sure all of you are aware, we now have cases of this novel coronavirus all over our country here in the United States, including in Michigan, where I live. And we had our first case at the hospital where I work earlier this week. At that point, we activated our hospital command center, which basically means we've sort of declared an emergency situation. And I personally have been putting about 18 hours a day of work in the command center, just trying to make sure that we are doing everything we can to keep our patients and our healthcare workers safe.
Yeah, and just this wasn't something I asked, but I had down. But last night, the Missouri governor declared a state of emergency. We have 4 cases in Missouri, and he kind of talked about, places kind of taking the charge, universities taking the charge. Obviously, you being at U of M, University of Michigan, does that mean kind of you become the testing center? You become kind of the place where people go?
Yeah, I think to some extent that is true. And as I'm sure all of you are aware, testing has been fairly limited.
Okay, so tell us about that. Why is that? What's going on there?
Well, I think initially what happened when this outbreak first started, the Centers for Disease Control and Prevention, which is where we take all of our guidance from, had fairly limited criteria for who we could test.
Okay.
Now those criteria have been expanded, but the actual availability of testing kits was very low. Like, for example, earlier this week in the state of Michigan, we only had 400 testing kits for the entire state. Mm-hmm. That is all changing now because there are private labs that are now offering testing And at our own hospital, we'll be able to offer testing by our own lab starting next week. So I think that is rapidly changing. So I think it's been really hard for anyone to get tested up till this point. We have been a testing center for our state, but what we've been able to offer to patients has been pretty limited so far.
And would the testing have held us back in terms of kind of getting this under control? Like not be having that availability?
Yeah, I think it did for sure, because we just didn't know the extent to which this virus was already circulating in our communities. So I think we were really behind in our response, unfortunately.
Okay, so let's step back all the way to the beginning.
Yes.
I'm going to talk to you with many of these questions as if I have just landed on this planet and everyone's running around screaming and I don't know what's going on. What is COVID-19, or as, people may refer, coronavirus?
Yeah, so COVID-19 is actually the name of the disease that's caused by this virus. And COVID basically stands for coronavirus disease. And the 19 is because the virus was discovered in 2019. The actual name of the virus is SARS-CoV-2. And SARS stands for Severe Acute Respiratory Syndrome. And I'm sure many of you recall there was an initial SARS outbreak caused by a different coronavirus back in 2003 that kind of spread around the world. So this is the kind of the SARS-2, basically. That's the name of the virus.
So does that mean it's like mutated? Like
it's basically just a different type of coronavirus. Okay. So there are actually many different types of coronaviruses. And within our communities, every winter there are coronaviruses that are spread around and most commonly just cause a cold, just, kind of a mild cold for most people. But every once in a while, there will be a new coronavirus that is introduced into human populations that can cause more severe illness. And that's what this is.
Okay. So for someone who's wondering, why is there such a panic about COVID-19 when the flu is much more prevalent and can be more serious?
Yeah, I think there's panic, first of all, because it's new. It's something we've never dealt with. We don't fully understand this virus yet and what it can do. We do know that it seems to be very contagious, especially compared with previous coronaviruses that have caused epidemics. We also know that the mortality rate with this virus, meaning the percent of people who become infected and die, is actually much higher than it is with flu.
As in what?
So with flu, the mortality rate, if you become infected, the likelihood of dying is around 0.1%. Okay. With this novel coronavirus, it's somewhere between 1 and 3%, we think. Mm-hmm. So it's at least 10 times higher than the flu. Okay. And 1% doesn't sound like a very high number, but when you're talking about millions of people becoming infected, that's a lot of people.
For sure. Yeah, absolutely. So, and who is at risk the most here?
So far, it looks like the people who are at highest risk are those who are older, especially over the age of 70. Okay. So it seems like younger people are relatively spared. That's not to say that younger people can't become severely ill, but it does seem like in younger people, both children and young adults generally have a relatively mild illness. But older people over the age of 70, anyone who has underlying heart disease or lung disease, anyone who has some kind of medical condition that compromises their immune system, those are the people at highest risk.
So it kind of does come down to your immune system. So you said about the elderly, people over 70, those with previous complications, that it's all about kind of how your immune system is handling things.
Yeah, that's correct. And we do know as we get older, our immune system has sort of a decline. So we know that older people are at higher risk of complications from any type of infection, including flu, et cetera. So this is not very surprising.
Okay. And then we said about underlying health issues. I had a question from Mark who wants to know asthma. Does that count as someone who is, at a higher risk there?
So I'm not aware that asthma has been sort of called out as a particular risk factor for having more severe illness, but I imagine that could be the case, but I haven't seen that in the medical literature.
Okay. All right. And then men and women, same risk?
It does seem like it. initially, when the outbreak first started, most of the cases were in men. And I think that has to do with, we think that this outbreak started in China related to the sort of seafood animal markets that they have there. And we think the initial demographics, with mostly men being affected, had to do with sort of who was, interacting at those markets. But now it seems like it's really equal opportunity.
Okay. And then children, two questions with this. I mean, as we've kind of said, children seem to be somewhat mostly, unless they have, some other health condition that's putting them at risk, seem to be mostly avoiding this. Like, are children at risk at all? And with them being this way, why is that, when we're told the immune system, especially in early childhood, is still kind of strengthening? So why would they be exempt?
Yeah, that's a really interesting question. And I don't think we fully know the answer to that. But I think it's very fortunate that children seem to be spared from this. I think we're all especially those of us who have young children, are very grateful for that. It is interesting, though, because when you look at flu, young children are at high risk. But with this particular virus, it doesn't seem to be the case. And I don't really think we understand that yet. One thing about children having probably a mild illness with this virus is that they are probably serving as vectors of transmission. So they have maybe a mild cold, but then if they're around, their grandparents, they could potentially transmit the infection. And then, older adults could become very sick from that.
I see. And then, just kind of going back to that one more time with pregnant. I am pregnant myself. I know I have many listeners who are also pregnant. Like, what are the precautions, effects on pregnant women and newborns? Like, we talk about immune systems. Well, surely a newborn doesn't have much of an immune system at all. It's got to build up over the years. So what are women who are pregnant and going into, I expect to have this baby during the time that this is still an issue. So what would you like to say to pregnant women listening?
Yeah, this is a very complicated issue. And I think so far, we don't have a lot of evidence that pregnant women are more severely affected when they become infected, which is good. But we know that pregnant women are at risk for more severe outcomes from other viruses like flu. So we are obviously always worried about the impact on pregnant women. So I think it's especially important for pregnant women to take measures to avoid getting ill. We do have a plan in place at our hospital. First of all, we are not allowing any of our pregnant healthcare workers to care for patients who have this coronavirus.
And that's across the board from early pregnancy right the way through.
Yeah. And also breastfeeding mothers, just because of that, that concern about potentially passing it on to the baby. We've also been developing a plan for what do we do if we have a woman who shows up in labor and is also ill. And so we've thought about that quite a bit. And I suspect that most hospitals are coming up with those plans. And it might involve taking sort of extreme measures to protect the baby, including separating mom and baby after birth, which I know it's a really hard thing to think about, but it might be the safest thing to do.
Of course. Okay. So you're still kind of working on that. Is there somewhere for pregnant women to go that you would recommend to is there a university or a location or a website that kind of is going to have the best information that you know of to follow that?
Yeah. So the CDC website has a lot of really useful information for different, populations of people, including older adults, pregnant women. I know that the American College of Obstetrics and Gynecology, their website also has a lot of information, and they've released some statements about, what they think are best practices for care of pregnant women.
Okay. All right.
Related to the situation.
Okay, great. And then, I watched a podcast with Joe Rogan. I can't remember, I should have written the name down, and an infectious diseases expert from the University of Minnesota, which is confusing because he kept saying U of M as well.
Yes.
But, he talked about how America will be hit particularly hard because of obesity and, diabetes. Is that kind of the case? Like, because that's kind of another risk factor that people might not be keeping in mind?
Yeah, I think that's something, again, that we don't really know yet. But we do know when we had the H1N1 flu pandemic back in 2009, we know that obese people were very hard hit by that in terms of becoming more ill.
Okay.
So I suspect that could be the case here as well, but we just don't really know the answer to that yet.
Okay. And as of right now, how does this compare to other worldwide epidemics? Like you mentioned H1N1 and you've mentioned SARS already. Like how does this kind of compare?
So in my opinion, this is much worse than those previous epidemics, just in terms of how far this virus has spread.
Yep.
So with the initial SARS epidemic back in 2003, that virus, it was actually more lethal, meaning that the death rate was higher, but it didn't seem to be nearly as contagious.
Okay.
And there were measures put in place early on that, sort of stopped the epidemic. This does not seem to be behaving in a similar way. With the 2009 flu pandemic, the death rate ended up being much lower than what we thought it would be. So it ended up, it was still obviously a very significant event, but the impact in terms of illness and death, I think, was much lower.
Okay. All right. So you mentioned about the, how contagious this is. How is this passed on? Initially we were told it was touching things. And, I've heard some things recently that a lot of it is more about breathing in the same air and it can linger in the air for 3 hours, which, if you're in a contained space, that makes a lot of sense of why things are shutting in terms of events. But how is this passed on and what makes it so contagious?
Yeah, so it's mostly, it's spread just the way that, regular colds are spread. So it's really person-to-person transmission, primarily through respiratory droplets. So when you're in close contact with someone who's coughing or sneezing, when you're within 3 to 6 feet of that person, you can be exposed to their droplets that they're kind of expelling from their mouth and their nose. And if you breathe those in, or if those droplets come in contact with your eyes, then you can become infected. That's really the primary route of transmission. The virus, we're not really sure how long it can stay in the air. But as a practice at our hospital, I can tell you that if we have a patient who we suspect has this infection, we would leave the exam room, for example, empty for an hour just to allow the air to clear out before we would put another patient in there. Okay. So I think 3 hours is probably a bit long, but maybe up to an hour or so. The other way that this virus can be spread, and this is important, but probably less important, is through touching contaminated surfaces. So if you have someone who's ill and they're coughing, then the surfaces around them at home or at work can become contaminated with the virus. And if you touch those surfaces and then you touch your mouth or your eyes, which we do all the time, then you can become infected. The virus, we know it can linger on surfaces for up to probably a few days, but we think the highest risk is in the first couple hours after the surface becomes contaminated, because after a while, the virus kind of dries out and becomes less infectious, if that makes sense.
Yep. Okay. All right. And I want to get on later to what we can do to prevent this. But for now, I want to continue with kind of just questions about it. So, there was a rumor going around that the virus will kind of go away in the summer due to the heat. Does that kind of seem to be the case?
So that's actually what happened with the initial SARS outbreak back in 2003. I am not convinced that will happen this time because we've seen a lot of transmission in places with tropical climates like Singapore, parts of Africa. So I'm not convinced this is going away when the weather warms up.
Okay. All right. Yeah. Thank you. And then is this something that will eventually go away, or like the certain amount of the population will be infected and then it just kind of is? Or is it something every winter we're going to have to, this is going to come back?
Yeah, that's a really good question. And I don't think we really know the answer to that yet. It seems to be the thinking of the scientific community that this virus will probably stick around for a long time and will maybe just become one of our regular circulating viruses that causes people to become ill every year. But I don't think we really know yet. I think time will tell. We do know that with previous pandemics, there have been waves of infection where So there was sort of a peak, and then it seemed to be going away, and then it came back. So that's always a possibility, which I know is not very reassuring, but it's just something we need to be prepared for.
Okay, great. Thank you. And is there a dose or a response between the amount of exposure and the severity of the disease? So if really, if someone sneezes in your face, are you going to get it worse, or is there anything related to that?
Yeah, I don't know that you would necessarily get a more severe infection if you had a significant exposure, but I think you're just much more likely to get the illness if you have very close contact with someone who's infected.
Okay, and what about the incubation period between the exposure and symptoms, or if not? Explain about the not situation as well.
Yeah, so the incubation period, meaning the time from when you're exposed to when you actually become ill, seems to be an average of about 5 days, but it can be as early as 2 days and as long as 14 days.
So I just want to pause you. So that means in theory you could get it on one day and then not get a single symptom for 5 days, but you are infectious that entire time?
Well, not necessarily. So there's a lot of debate right now in the scientific community about whether you are truly contagious when you're not having symptoms. We do think that most of the transmission is occurring from people who have symptoms.
Okay.
So if you are not sick, you are likely not contagious to others.
Okay. But then what about, you mentioned children. How do they come into that then?
So, we talked about children a little bit. So I think that, as I said, children tend to have maybe a milder illness where, it may not be recognized that they have this particular infection. And I'm sure, you have a young child, and I do too. I have 2 young children, and they make us sick all the time, right? They bring things back from daycare, and that's just very common. It's very difficult to avoid close contact with your children, right? So they're really efficient vectors of transmitting viral illnesses, both to adults and to other children.
So they may have symptoms, but they're so mild that they, just being children, don't feel the need to say, I have a little bit of a sore throat. Is that kind of, or whatever the symptom is?
Yeah, exactly. And I think, those of us, again, who have young children can attest that they have a runny nose all winter, right? I mean, it's like, it just seems like they're always sick. And so it's just kind of like that. It's like, oh, my child has another cold, but, it really could be something, something more significant.
Okay. And then in terms of, getting the virus, being infected, once someone gets it, can you get it again in theory? I mean, I know obviously we're very early stages here, so that might not have even been thought about yet, but is this going to be something that kind of like the flu, it's going to keep kind of modifying itself and coming back and we can keep getting it?
Yeah, I don't think we know yet.
Okay.
And with the flu, we know that there are many different strains of flu that circulate every year. And so we know you can keep getting the flu repeatedly because the virus mutates and you're not immune to that particular strain or whatever. I don't think we really know the answer to that yet for this virus.
All right. Thank you. And then if a family member contracts COVID-19, what should we do to care for that person while minimizing the risk of contracting the virus ourselves?
Yeah, that's a really good question. Because I think that most people who become ill with this will have a relatively mild illness where they can stay at home, but they may need someone to help them. We've all been sick before. We know how it is. You just need someone to help you with kind of your usual activities that you do every day. I think the key for anyone who's a caregiver is just to be very meticulous about washing their hands, about wiping down contaminated surfaces, and pretty much any type of disinfectant should be effective against this virus. But the truth is that it's really difficult when you're caring for someone to completely avoid exposure. And the recommendation really is if someone's infected that they really should try to stay away from other people as much as possible. But in reality, we all know that can be challenging.
Mm-hmm. Okay. And we have mentioned, about you've said about kind of separating themselves and we've talked about quarantining. So let's talk about, if a family member does have some kind of illness that seems to match COVID-19, whether they've been tested or not, and they say, okay, I need to self-quarantine. How long should they quarantine? Should the entire family, just assuming they would have caught it, quarantine? What are the thoughts there?
Yeah, these are really challenging questions. And it's especially challenging, I think, because we're also still in the middle of cold and flu season.
Yeah.
So we're seeing a ton of respiratory viral infections that are not COVID. So it's really hard if you don't have a diagnosis to know exactly what to do. The recommendation, though, is if you become ill with fever and cough, you should really try to isolate yourself from other people as much as possible. So if you're living in a household with other people, you should try to sleep in maybe a separate bedroom. You should try to use a separate bathroom. Really just try to avoid close contact, meaning coming within 3 to 6 feet of other people. But, in reality, that's very challenging to do.
Okay.
In terms of how long, I think one of the questions you had was sort of like how long you're contagious to others. Mm-hmm. And again, that's one of those things where I don't think we really fully understand the answer. I know a lot of people have been kind of going with that 14 day, you should try to stay isolated for about 14 days. Mm-hmm. Certainly you should stay isolated until your symptoms go away. And once you're not having symptoms anymore, once the fever and cough resolve, it's much less likely that you would be contagious to other people.
Okay. All right. Thank you. And then, a lot of schools have been closed, events have been cancelled. What are your thoughts on school closures to contain the virus? Like, is that a good idea?
Well, unfortunately, I think all of these closures are necessary at this point if we want to stop widespread transmission. But I do recognize that it's very painful, especially as a parent, again, trying to figure out what to do with my children for the next few weeks. But I think at this point, this is really what we need to do to keep people away from each other. Mm-hmm. This is the principle of social distancing, where we just really try to avoid contact with other people as much as possible during this time.
But then, so this has been one of my concerns, or not concerns, but what I've wondered about, we take somewhere like China or Italy where there's been a lockdown. Once the lockdown stops or the schools go back up, you just need a few people who have just caught it to make it spread around again. Like how, if you close a school and you remove these events, isn't it just going to come back around when everything opens up again?
Yeah, and it will, is the truth. And so you've probably seen that. I mean, this is all over social media right now, all over the news. There's this idea of flattening the curve. Mm-hmm. So what we're really trying to do is to limit the sort of the peak of transmission and make it sort of more of a steady state of transmission. And that's really to avoid overwhelming our healthcare systems. Because if we have a huge number of people who become infected all at once, our healthcare system cannot handle that. Mm-hmm. Whereas if we spread the transmission of the virus over a longer period of time, that will not overwhelm our resources quite as much. So we know that when people go back to school, there will be infections that continue, but it will be at a much lower level that would be manageable.
Okay. All right. And so people can be prepared. How serious is this in terms of, we've heard 40 to 70% thrown around. I've heard 80% thrown around. What percentage of the population is right now estimated to end up with this at some point?
Yeah, I think like you said, the numbers are all over the place, and I think we just really don't know. And the problem is that all of these estimates don't really take into account everything that we're doing to stop the spread of this virus.
Okay.
So when you hear these 80% numbers, that would be if we did absolutely nothing.
Okay.
To keep people from getting infected. Okay. We're hoping to keep that number much lower. That's the goal.
Okay. Even though we talked about, flattening the curve, those people would eventually get it down the road when.
Yeah.
Okay.
But yeah, I think it's very difficult to predict actual numbers at this point. Uh-huh. And it's one of the problems, again, talked about this with the testing, is that we don't really know how many cases we have right now. We have no idea what we're seeing. The numbers that are reported, this is the tip of the iceberg.
Okay. And then just for, kind of people being prepared, UK Prime Minister Boris Johnson said, to the UK a few days ago to expect to lose loved ones. How serious is this in terms of what we should be expecting for number of deaths with, should everyone kind of be going in that they could lose someone that they love? Like, How serious are we talking here?
Yeah, I mean, I think that's a real concern. And I think about my parents who are in their 60s and 70s. I'm sure we're all worried about that.
Mm-hmm.
We know there was an outbreak at a Seattle nursing home where a number of residents died. So this is a very real possibility that
Mm-hmm.
many of us could lose someone that we love. It's hard to give a sort of a probability of that happening, but I definitely think that heightens the anxiety because we think, oh my gosh, this really could be. When we think about epidemics, it's usually somewhere else, right?
Yeah.
But this is here, and we're all worried. I know, but it's hard to say for sure.
Do you have any estimates on like a death toll, like what we should expect, like in the US or worldwide?
Yeah, I mean, I think again the estimates are largely based on what would happen if we didn't take any measures to prevent this. So I think it's really hard to say at this point.
Okay. All right. Thank you. Okay. So let's talk about a vaccine. Do we know what type of immunity is developed from COVID-19 and how far away are we from a vaccine?
Yeah, I know that there are currently vaccine candidates that are in development, but developing a new vaccine, especially this would be a totally new vaccine. We were able to develop a vaccine for H1N1 influenza relatively rapidly within a few months because we've developed flu vaccines before, but this would be just a totally new thing. And so, even though there are current vaccine candidates in development that are starting into human trials, I would say we're probably at least a year away from having a vaccine. So it's going to be a while. I don't think we can count on that.
And why is that for someone who's thinking, well, if you've got it now, like, why can't you just start giving it out next month?
Yeah, it's the reason is that you really have to, for vaccines, you really have to do a lot of testing on them to make sure, first of all, that they're safe and also that they're actually effective. And then actually developing large scale of production of a vaccine, it takes a lot of work. So it's not really so simple, unfortunately.
Okay. And is this expected, I don't suppose if it's going to be an annual vaccine or a kind of one-off, like chickenpox kind of thing?
Yeah, I suspect it would be more of a one-off kind of thing, but it's, I think until they start doing trials and seeing how people respond in terms of their immune system, it's hard to say.
Okay. All right. And I know this is a very difficult question for you to answer because of all these unknowns, but once a vaccine or a cure is kind of developed, for someone wondering how long it's going to take for life to return to normalcy, how long to stop isolating, quarantining, being afraid of everyone, like how long should we expect to kind of be in this state?
That's a really good question. I was actually thinking about that on my drive into work this morning. When will things go back to normal? I think that's what all of us want to know. And I think it's going to be probably a few months before things go back to normal.
Okay. Yeah. I've had 3 to 6 months mentioned.
Yeah, that would be my suspicion as well.
Okay. All right. So then what can we do to protect ourselves? You mentioned hand washing. Does it have to be the 20 seconds that we're told? Hand sanitizer has all but vanished from every store.
Yes,
so that's kind of
a
bit useless to give that advice now. So what can we do?
Yeah, so So I think social distancing. So really just staying away from other people as much as you can, staying at home, as painful as it is, not going out to crowded areas, not traveling, really trying to avoid going out in public as much as possible. And then if you do have to travel or go out, just making sure you wash your hands frequently, and soap and water and hand sanitizer are both effective. If you don't have access to hand sanitizer, 20 seconds of hand washing. I know if you look on the internet, there are all sorts of songs that you can sing for 20 seconds while you're washing your hands. And so that's really probably the most important thing. So social distancing, hand washing, and then really, and this is almost impossible, but trying to avoid touching your face. We tell people to do that. And I know there have been all these press conferences where you've seen people tell you to do that, and then they immediately touch their own face. So it's just human nature. We do it all the time. So I think just trying to keep your hands clean is important.
So on that note, the mask situation has been a bit of a crazy thing that's going on. Tell us who should be having masks, who shouldn't. I don't even think people can get hold of them anymore, but tell us about who should be wearing masks.
Yeah, I think honestly, masks should really be reserved for people working in healthcare settings. Masks are not really useful for the general public. These face masks that you see, they're really meant for very short-term use. They're not meant to be worn all day long because they quickly actually become kind of just from us breathing in and out, they become kind of damp and they kind of lose their effectiveness very quickly. They're really meant to be used in healthcare settings for a single interaction with a patient. They're not designed to be used all day. They really, I think they offer sort of a false sense of security as well, and may lead us to do things like not washing our hands or thinking it's okay to touch our face. And it's really not an effective prevention measure for the general public. It's not advised. And really in our health system right now, we're in a crunch, a supply crunch for masks and all these other things. So it's really important to make sure that we're using those appropriately and allowing us as healthcare workers to keep ourselves safe and protect our patients.
Okay, thank you. And how, we mentioned immune system earlier, and how can we work on building our own immune systems to kind of be able to handle this with a mild case, if we get it?
Yeah, that's a question I get a lot. And unfortunately, there isn't some super immune system booster pill that we can take or anything like that. But I think, just sort of general things that you do to protect your health, making sure you're eating a good diet, making sure that you're exercising regularly if you can, just kind of the things that we do for our general health also help your immune system. But I don't really have any specific advice. Unfortunately, there's not really, like I said, there's not any magic solution for that. Yeah.
Thank you. All right. Okay. So let's just go on to some running questions that people had. Do harder type workouts compromise your immune system? So is it better to just stick to easy runs, short runs? Should we be cutting down on everything to kind of keep our immune systems high at this point?
So I'm a runner, and I unfortunately haven't been able to run very much lately just because I've been working all the time. But I think if you're a runner, you should continue to run as much as you can throughout all of this. It helps relieve stress. It keeps our bodies healthy. What I would encourage people to do is probably to avoid going to the gym if that's something you do regularly. If you're going to run, you should do that on your own, either outside or at home. You should keep your workouts at home probably. But I would encourage people to keep running. I don't think we have any evidence that hard workouts compromise your immune system. If anything, we need to try to stay more active during this time.
Okay. And so you said to go outside, but what about running in groups? Runners, if they're going to run together, they're not going to be 3 to 6 feet apart. So what do you say there?
Yeah, that's something that's come up actually on our Mama Docs Run This group a lot is what do? I have a running group. And really, I would say, honestly, I think it's fine to run with other people, but you should probably keep it to maybe 1 or 2 people and not like 10 people.
Okay.
And just obviously make sure if you're sick, don't go running with your running group,
or
that
if
kind
you
of
feel
thing.
a sneeze coming on, being like, move, get away from me.
It's hard to give. Yeah. And then probably just try to, keep it like 3 feet apart or something like that.
Yeah.
But, I think for most of us who are runners, running is really it's our outlet to relieve stress. Mm-hmm. And I think it's really important to keep doing that if we can during this time, just to try to keep some sense of normal.
Okay. All right. Thank you. And then related to, being outside and running, what about, one of my listeners wants to know, sometimes when I run, my mouth gets watery and I spit. Should I try to avoid that as much as possible? Is that?
Oh, I don't know.
That's a runner question for sure.
Yeah, I sort of have opinions about that just because I think it's kind of gross when people do that just on principle. I don't know that that's really, I would say, yes, you should probably try to avoid that. Okay. But I'm not sure that that's going to be like a major source of transmission to other people if you spit on the sidewalk.
Okay. And then another very specific one. Should we worry about running downwind of pedestrians, or will holding our breath or exhaling while passing pedestrians provide any protection from airborne particles?
Oh my goodness. So again, I think it's all about just trying to keep some distance between yourself and other people. I think if you're running outside and you're running past someone who happens to be infected, again, as long as you're a reasonable distance from that person, like 3 to 6 feet, you should be fine. It's very unlikely that just having like a few seconds of exposure to someone who's 3 to 6 feet away would put you at risk.
Okay.
But I wouldn't advise trying to breathe in a different way or hold your breath. That just doesn't seem like a good idea in general.
Okay. All right. And I think this is the final question. Should we be worried about taking energy gels, squeezing a gel pack that we've torn open with our hands while running? So then obviously you're putting your hands to your face and near your mouth.
Yeah, that's a good one. I haven't thought about that before. And I mean, I would say yes, because I can't really think of a way to do that without contaminating it, right? So I don't really know what the solution is to that. Yeah, there you go. Yeah. And yeah, if you can find some kind of fuel where you don't have that risk of, contaminating whatever it is, that might be good. I mean, honestly, I think if you wash your hands before you go for a run and you're not touching anything else while you're running, the risk is probably very low. Okay. But it's an interesting question.
Yeah, for sure. No, I mean, it was interesting getting these questions because I put it out there and I got 50 plus questions, but so many of these, wow. I was like, wow, I wouldn't have thought about that, but that's very true.
I know.
So, okay. Anything else you would like to tell people in terms of their life, in terms of their running? I mean, I'm going to go on after we hang up here to talk about those dealing with marathon cancellations, what to do with your training, things like that. So nothing about that, but anything that you as an infectious diseases expert would like to share with the audience?
Yeah, I think that really the key right now is, I know that this is a very high anxiety time for all of us. And I think especially as runners, I mean, I was supposed to run the London Marathon, and obviously now it's delayed. Yeah. And it's very disappointing because you put in all this time training. But I think it's really important to recognize the reason for that and that we really need to do our part to try to help out our fellow humans during this time. Yeah. And I think while it's okay to have and appropriate to have some level of anxiety, I would really encourage people not to panic. I think if we follow sensible precautions that we've been advised to do, I think we can all, we all just do our best to keep ourselves healthy, to keep our family members healthy. And I really think that we should be I know we're supposed to be social distancing right now, but I think we really need to sort of keep our fellow humans in mind right now. Yes. A lot of us are stressed out with needing childcare, and perhaps we have elderly neighbors who need help. So I think it's, really just doing whatever you can to sort of help others get through this is really important.
Great advice. And just while you're talking about that, one more note, I think those of us with kids, it's very hard. I'm having a serious conversation about this. There's this new thing that's, they've said this about the virus or whatever. And your kid is just like, attention, or like, I want this. And it's very like stressful because you're just like, can you just wait a second? But like to them, they don't know what's going on. They don't have any kind of understanding of how serious this is. So kids are good reminders to kind of, life still is going on. They're still hungry and things like that. But also that, I have to keep reminding myself that I am on edge. Like she's just acting normal. Yes. Mm-hmm. And I'm just being a bit on edge. So I think you're right that checking in with one another. I mean, we have these communities. You have Mama Docs run this, Running for Real Superstars. If anyone hasn't already joined that, go join it. We have a wonderful community in there, all very supportive. And even though we are not physically allowed to be together, like you said, it's very important to still lean on people and reach out to people if we think they need it. So thank you, Emily.
Yes.
And for you, London Marathon being it was September, October?
October.
I've told Steph Zwicker and Diane Rosen that that October is my favorite time of year to go home. So actually, in some ways, it's going to be kind of cool going to London during that point. So for you. Well,
I've decided to defer until next year. I'm actually running the Berlin Marathon in the fall, which is the week before London. That, so sure.
Okay, cool. Well, awesome.
So I will be doing it in 2021.
Okay. Well, I will look forward to hearing how that goes. All right. Emily, thank you so much for giving us this time. I know you're stretched thin, so we really appreciate you. And thank you for all the work you're doing, not just sharing this with us, but, 18-hour days, very stressful. We appreciate you. So thanks for all that you're doing to help us.
You're welcome. It was a pleasure to join you.
My friends, if you have a minute and you could leave a review on your favorite podcast player, Apple Podcasts, aka iTunes, Stitcher, Overcast, Pocket Cast, Spotify, or whatever else podcast player you use to listen to this podcast, or if you would subscribe to this podcast, you will help me get out in front of new runners to make our tribe even bigger and even better. It might not seem like you as one person can make a difference, but really it helps a lot. And it shows me you appreciate the hard work I put in for those. Thank you so much. Okay, so we just finished that episode with Emily. She obviously gave us a lot of really helpful information there and kind of cleared a lot of things up. I mean, I know we're all kind of getting information from different places and it's just constantly changing. As you heard, there's a lot of answers that they just don't know yet, which, yes, is kind of scary, but also, they're working on it and they're doing the best that they can. And I think it's good for us to remember in moments like this that they are doing the best that they can, that the medical experts and the medical professionals are really, trying hard to do this. And it's the same with races. I mean, I know many people are frustrated with races cancelling and not giving refunds and things like that, but we have to kind of keep this in perspective. Like, this is serious. You heard from her, like, how much, worse this has been than other things that have gone around in the past. And I think we need to keep reminding ourselves of that everyone's just trying to do the best that they can. The races, they don't want to cancel their races. Like, it's not like it's a personal choice that they think, I get the weekend off. Like, they really want to put it on. They enjoy doing it. And it's the same with these medical experts or, anyone, people who work at the airlines. We have to remind ourselves that they didn't ask for this, that they didn't bring this on. They're trying. And the people on the phone lines are just doing the best that they can. So I think this is a real time to bring us together if we allow it as humans, because we can remind ourselves that everyone is stressed. Everyone is scared. No one knows the total answer, but, all we can do is just do what we can and try and be kind towards one another. So I'll talk about that later, but I understand, I just said that about the races. However, I do know how crushing that is. Like, it is devastating. I mean, I know you can see the logic of why you should be okay with it and why it shouldn't matter. And there's life and death on the line. And so why should you be upset about a race? But I also understand how hard that is. And we've all had situations where a race has gone bad and we've struggled to get over it, or we've got an injury right before a race, and it does make you feel depressed. And this is nothing different. And especially with, like I said, the panic and all the other stresses that are going on. Of course, your running is going to be one thing you feel like you can control, and yet that is taken from you. And especially if you put in all these weeks of hard work and hard training to be ready for a race, and then suddenly that race isn't there. I know that's difficult. And in this second part, I just wanted to kind of give some advice. This will come out as a written guide as well. So if you want to get yourself a copy, you can go to tinamuir.com/COVID-19 guide. That's TINAMUIR/COVID-19 guide, GUIDE. And you can get yourself a written copy of my conversation with Emily, kind of broken down a little bit just to take out any excess words, and also my recommendations with what I'm talking about today. But I thought maybe, some of you had some questions. I'm going to try and answer those as best I can. But also I thought maybe we'd kind of go through some scenarios of what you should do, because it is a bit overwhelming with knowing what to do with your races, especially if they are races that were a month away. You've done most of the work. So let's talk about that. All right. So I don't know how to do this really. I think I'll answer your questions first, and then we'll kind of at the end kind of do a wrap up and break down the kind of situations you could be in right now. So first, how should those of us affected by marathon cancellations only a few weeks out from race day deal with it in terms of practical application to our long-term training to maintain fitness and motivation? So this question is, I think, probably the situation that many runners are in. And the motivation aspect, I'm glad you mentioned that, Chris, is very important because it's so easy to feel totally deflated without a race on the calendar. And Chris did mention in a follow-up kind of question that connects to this, I've already read countless articles giving me advice such as focus on another race that's more likely to go ahead, like a park run, which is in no mean disrespect to park runners, but it's hardly comparable to a substitute if their cancelled race is a marathon we spent a month's training for. And in that situation, I hear you. I think back a lot to how I would have felt as an elite. And yeah, I would have been devastated to know that not only was my race cancelled or unavailable, but it wasn't like there was another solution. I mean, I think we've had situations like this in the past where races have been cancelled, but you've always been able to kind of set another race instead. So a few weeks later or just that weekend or even a month later and say, okay, they'll do this instead. And yeah, it's hard to kind of readjust and figure out those final few weeks, but at least you have something to focus on. Whereas it's hard to be motivated when you really don't know when the next opportunity to run a big race or even a race may be. So I totally get what you're stressed about. I think that is, expected. And I will go over that in kind of the situations at the end of what I think people should be doing with my recommendations. Obviously, it's going to depend heavily on what you are doing. And this is where, if you've been someone who's been on the fence about getting a coach or a training plan, that's where this can really kind of come into play, because the coach specifically is going to be able to tell you what the best course of action for you based on your training is. And with this, right now, I did ask Steve last night for some recommendations, and he was really having a hard time. Steve is just a genius coach. He's so good at what he does, but he kept saying, like, I can't give a blanket answer. It really depends on so many factors within that athlete. So if you have a coach, absolutely speak to your coach. But if you don't, this may be a thing to kind of give you that final nudge to go find someone. And I'm not saying this because I am a coach. I'm not. I don't do coaching. We do have our training plans for 5K, 10K, half marathon and marathon. If you are interested in that, they're 100% effort-based. And you can find those in the guide, the written guide for this, or on the show notes for this episode today, which are tinamio.com/COVID-19. So tinamio.com/COVID-19. And there I will have links to our training plans if you want them. But all right, getting to Chris's question specifically, how can you deal with it? It is difficult when people are suggesting park runs. And yeah, there's nothing wrong with park runs or, local 5K short things. But I get it. It's not the same, is it? The Rambling Runner, Matt Chittum, is doing a virtual race series. I will put, again, links to that in the show notes, tinamio.com/COVID-19. He is doing a virtual race series, and there's probably quite a few virtual race series around that you could maybe be a part of to kind of give you something to work towards if you want to set a date, if you need that for your motivation. But if not, then I'm going to give you some suggestions in a few minutes when I give kind of the general overview. So the second part was, should we just keep repeating the middle weeks of a training block in anticipation of new racing opportunities once this fizzles out? Stick with the schedule and plan on running the distance solo on the day anyway to achieve some kind of quantifiable goal, or start a whole new training schedule from scratch? That is kind of the big question, isn't it? What what exactly do you do? Do you halt what you're doing and just kind of say, write this off as a wash, or do you keep going? Again, that's going to come down to very specific. And again, I'm going to go over that in just a second. So maybe I should actually do that right now and kind of go through some scenarios. So let's just do that instead. And as you know, friends, I'm not really a throw an episode up at the last minute kind of girl. My episodes are actually planned way in advance. I've already started recording like May and some of my June episodes. So this isn't really my kind of thing, but doing the best I can, all right? As is everyone else. Okay, so let's go through some scenarios. Your race is cancelled. Let's just say that you have a big race, and I'm talking marathon or half marathon here. I think if your goal race is a 5K or 10K, you should still be able to find alternatives to do. So this should be less of a problem. So I'm talking more marathon, half marathon, or some other distance that was your goal race. So your options are do a time trial, on the day that you were supposed to, do a time trial now, or just cut your losses and start again. So if you are going to do a time trial, I would say if your training is going well, continue training as you were for your race. And yes, if you find your motivation is lacking, which it may well be, then you may reassess this as time gets nearer. But if it's going well, keep going with that momentum of training. Don't allow this to stop you. And then do a time trial on that weekend. So you may want to find a course that's similar to the one you were going to do. You may want to do a flatter course somewhere near you. You just want to make it as close to a race situation as possible. So you don't want to be crossing roads and stopping in the middle of roads all the time. So as smooth as you can make the course, I would recommend doing that. But at the end of the day, you have to remind yourself, this is just seeing where you're at. This is just a good indicator. You can't put too much pressure on it, and you are not going to be able to run the same as you would on race day because you're not going to have the adrenaline, you're not going to have the other runners, you're not going to have that same level of motivation. So if you fall way off what your goal was for your race, that is okay. This is just kind of to see where you're at. This is just kind of to get a hard effort in and to stop you from feeling like this was a total waste of time. If your training hasn't been going great, I would probably say it's time to cut your losses and just stop. And this is where we will have some recommendations in a minute. But this is Steve and I talking here. We'll have some recommendations in a minute if you are going to do that. But if training isn't going well, I really don't see the point in continuing on when you already aren't feeling great in order to do a time trial. That really isn't going to count for anything. It's just a great place to see where you're at and to practice everything about race day. So in which case, if you are going to cut your losses and just stop, I would take 3 to 5 days off, just totally resting, kind of be with your family, be at home, take 3 to 5 days off, and then do a speed segment. Now, when we say a speed segment, I had to push Steve really hard to give me these answers, by the way. This is like 5K, 10K training. So in this case, you want to pick a race in the fall to replace the one that you were missing, and then count backwards however many weeks you want to have your training for the marathon or the half marathon or whatever the distance is, however many weeks you want to do. So let's say most people do 12 to 16, you'll count back that many weeks. And in the time between then and now and that date of starting, you will do like some 5K, 10K stuff. So as I said, we do have a 5K, 10K plan on my website. If you want to go use that, you can get that again at tinamio.com/COVID-19. But it's really talking about doing maybe 1 to 2 workouts a week, one workout with 2 to 6 minute repeats and one with 30 to 90 second repeats. Now, I know that's very broad. And again, I really had to push Steve to give me these answers because it's not easy to say a blanket statement. It has to be based on you, your experience, like your mileage. Some people are going to be able to handle more. I do have some workouts on my website, which I will again put links in the show notes with examples, specific examples of workouts like 10 by 1 minute or things like that. So if you go to the show notes, you can get your hands on those. But again, a coach is going to have a better shot at doing that for you. But we would recommend doing a speed segment. We always did that before my marathon build-ups. And I really think that makes a massive difference. And it's one way that this situation can force you out of your comfort zone and kind of make you give that a try. Because maybe in the past you've said, I'll do some speed, but then you've already got another race planned and you just haven't gone through with it. Just like I always keep saying that I want to do a kickboxing class or go horseback riding or things like that, but I never do them. This is your opportunity. 5K, 10K training is much easier to squeeze in around whatever situation you are in. You can get there running from home, do it. You can usually find a space where you can do this kind of workout rather than a longer workout, which is more difficult to find. So use this as a silver lining. You can build your speed, and your speed will help you massively going into a full longer race. Now, with that speed stuff, as I said, these are short intervals, but I'm not talking about 200 meters. I'm not talking about 8 by 200. This is 5K, 10K stuff. So if you are going for a marathon, mean, if you're doing half marathon or 10K training, then maybe, you can do some shorter stuff, but we would recommend doing some speed stuff. And then once your 16 weeks or whenever you want to start your training plan begins, give yourself again another 3 to 5 days off before you begin that, and then go into that. So you will do 3 to 5 days off as of now or whenever you want to take that. Take those days off, build yourself into a speed segment, just doing a few months, few weeks, whatever it ends up being, of some 5K, 10K stuff, and then take another 3 to 5 days off and start your program, and then go from there. All right, so if you have a postponed race, like a Boston or a London, or there was one more major one, Paris maybe, and I'm sure there's many other races where your race was cancelled or postponed, and you might as well just pick a September, October, November race instead. Again, you have the option of doing a time trial, but you have to decide based on what I said earlier about if it's going well, whether you want to do a time trial on the day, whether you want to do a time trial right now and just see where you're at and then start again. It's up to you. It really has to be your choice and how you feel your training is going and how you feel mentally. If you mentally are totally and utterly defeated, I would not recommend doing a time trial because you're just going to destroy your confidence. In which case, we recommend taking 3 to 5 days off. Now, I know these days off may seem unnecessary. You may think, why am I taking days off? I didn't do the hard race. I didn't do anything to warrant that, but you did. You've done training, you've put in hours, you've spent that mental energy pushing yourself, and then with what's going on, our minds are so stressed. We are so stressed. So it's just going to give you that mental reset to be able to go into this next block with confidence and with kind of feeling refreshed. So we would say to take 3 to 5 days off, either as of right now or as of your time trial. 3 to 5 days, you're not going to lose anything. It's not going to affect your fitness at all. So don't worry about losing fitness. I know it's hard to take it as runners, but I really, really, really think it's so important. And that's why we've done, most of you who listen to me often will know that I say after a marathon, you should take 7 to 14 days off. That's not why I'm saying 7 to 14. We're doing 2 little blocks of 3 to 5, which also eases your confidence as you're not taking so many days off. So we would say 3 to 5 days off, doing a short speed segment, 5K, 10K training. Again, if you don't know what to do, if you don't know what workouts to do, I will have links in the show notes for sneaking speed into your training, and then also our 5K, 10K training plan if you want to have a look at that. And that's all effort-based, so it takes the pressure off. And then we would recommend taking another 3 to 5 days off before you begin your marathon or half marathon or whatever distance build-up. So again, you count back the number of weeks from the race you are looking at and do 3 to 5 days off before that. So that kind of explains what we suggest people should be doing. But again, it's really going to depend on your mileage and how well the workouts have been going, how you feel, if you are stressed, how your work situation is. Do you have kids around? What ability do you have? The nice thing about 5K, 10K stuff, doing some speed stuff, is the weather is getting nicer, so you can kind of get in and out with your workout, and then you can go and enjoy the outdoors with your family and not feel so dead because you've already done a 24-mile long run. You can go for a walk with your family or do something together as a group. So I really think there's so many benefits to everyone kind of getting some speed stuff in there, and it really, really will help your long distance stuff. Okay, so let's go on to, I think that would have answered Chris's questions. There's just one more part, which is, I get the reasons behind it, but I'm gutted to have my spring marathon cancelled as it has been months of build up for me. Even before starting the 16-week schedule to build a base level of fitness unlike anything I've ever had before. I was set to break 4 hours for the first time and a PB by over half an hour. I understand that's hard. I really do. And you're not alone. There are so many runners out there. One thing that jumps out to me, though, is saying things like that. This is, the best training block. This is the first time I hoped I was going to break 4, PB by over half an hour. You already had a massive amount of pressure on yourself there. And I think many people get themselves in that situation where they think this was going to be it. This was going to be the dream day. And this is where things really come to bite us, because if we've had a really good training block, the race usually throws some kind of curveball at us and we're not prepared because we feel so confident going in, almost too confident, that we forget how painful it's going to be or how we're going to handle things when they go wrong. So I know it's frustrating and I know it feels like it was a waste, but it wasn't a waste. You still put all those weeks of training in, you still put all those hours in, all that mental toughness that you built by pushing through. It's still there, and it will be there in the fall. It will be even a little bit stronger if you do what I said with doing some speed work. So I know it's frustrating, and I wish I had an answer for you, and it's totally okay to be gutted or devastated or crushed about it. And there's so many runners listening to this right now feeling the exact same way. So use one another, speak to other runners who also have their race cancelled, cry about it, eat ice cream over it, like put your fist in a pillow for it, whatever. Like, it's okay to be upset. Like, you've put a lot into this and it's okay to feel robbed of that opportunity. All right. So, and then the second question was tips on extending out a training plan in the event of a rescheduled race. For example, my race is currently scheduled for the last week of April, but it will likely be rescheduled a month or so. If it is scheduled a month or so later, which I honestly, based on what Emily said and based on other races, I would be very surprised if it was scheduled a month later. I think in all likelihood it's going to be pushed to the other ones, in which case you should do what I've already recommended. If, however, it is pushed by a month, yeah, that's quite a tricky situation because you aren't going to know. I personally would scratch that race because you aren't going to know if that race is going to be cancelled. And for me personally, it would be more upsetting for me to have them say, okay, we think we're going to put it on again in a month's time, but not really know if they're actually going to go through with it. So I personally would just get that peace of mind and say, you know what, I'm going to draw a line in the sand and I'm going to go for something in the fall. That is my personal opinion, because I just feel in this situation, we can't really guarantee that everything is going to be cleared up by a certain date. Obviously, they must feel confident enough about September and October to push it back to that date. They must have some experts telling them that they think it will be finished, well, not finished, but calming down by then. But I have to just give you my opinion, and that would be I would cut your losses and pick a full marathon or a full race. Okay, so I just want to talk about the mental side of things for just a few minutes. I know I'm already getting close to an hour and an hour and 15 minutes. But the mental side of things, I just want to send a reminder to check in with friends who do struggle with their mental health. Really check in with all friends, all loved ones. But those who have struggled with depression or have anxiety or really do have kind of a tough time in situations like this, be sure to check in with them. I have recommended many times, I believe a lot in voice memos. They take a minute to record, or you can do more. Mine usually end up being 4 to 5 minutes. You can do voice memos and just send them your thoughts. Say, hey, I'm just checking in, wanted to see how you're going. Tell them a bit of an update about you. Like, imagine that you're just sending them a little message to check in, and people love that. And I love that. It's just so nice to receive a little voice note from someone. If you have WhatsApp, there's a little microphone symbol, and then you can swipe up with that microphone symbol and it will record until you tell it to stop. And then on iPhones, you have to hold down the little microphone symbol with iMessage and it will send a voice memo for as long as you want. But send people send people a text, give people a call. Like, this is a great time to connect and re-strengthen your relationships. And especially to those people who need it most, who are feeling maybe trapped inside, especially those who are older, who are at risk and maybe are scared of going out, just letting them know that you're thinking about them and that you're there if they need you. It's going to go such a long way. And on that note, if you are someone who feels alone, you can reach out to me. I have plenty of ways to get in touch with me. There's a contact me page on my website, tinamuir.com. You can send me a message if you prefer. But let's just be supportive of one another and help one another get through this tough time, because it is difficult. And we know that this situation has taken a lot away from us, a lot of events, a lot of things we were looking forward to, a lot of opportunities to go explore things. But it's not taken away our relationships. It's not taken away our running, our reading, our time with our family, being outside. Make the most of those things. What can we do? Like I've mentioned many times about my stopping running and getting over my amenorrhea was a great time to build my relationships, to fix things, to actually have a conversation with those you love, even if it's on FaceTime or Skype or whatever. Connect with people, call them. It really, I know it can be tempting to it feels almost like a burden, like, oh, I have to call blah, blah, blah. But you always get off the phone feeling so glad that you did, because either you made their day by calling them up if there's someone who maybe do get lonely or don't feel like they are, thought of much, or you get off the phone and you're like, wow, I remember why I love that person. So try and do it. Just try and make some phone calls, check in with people if you are at home a lot, and just use this as a moment, to be outside, to go explore acorns with your kids, or to go for a walk in your neighborhood and really look around the houses. Just you try and see the advantages. It's reading, as I mentioned, reading. You can learn and read all these books that you've been telling yourself you want to read for years. Why not make this the time? I know this is scary, and I honestly can't tell you that I've been sleeping great either. I have definitely not been sleeping very well, but we have to, as I said in the interview with Emily, we have to remind ourselves that we are on edge. All of us, we are feeling that kind of low level of anxiety at any time. And so in many situations, we are going to be jumping to conclusions. We are going to be thinking negative things about tiniest of situations, and little things that would normally not bother us are going to bother us. So just keep that in mind. Keep telling yourself it's okay to be scared. It's normal to be scared. We are all feeling scared, and that's expected. So just wanted to say a few more little things there at the end there, just to kind of remind us all to keep our perspective and to look for the silver linings. All right, so thank you so much for listening. We are back to our usual episodes on Friday. I have Amanda Brooks coming on the show from the website and book now, Run to the Finish. And I just quickly want to throw in here, I know I said no ads, but I just want to give a shout out to Athletic Greens. I really feel that's helping my immune system, and it gives me a lot of confidence that my body is in a good place. If you've been thinking about it, this might be the time to give it a try. You can get that 20-serving travel pack for free in the US, Canada, and most of Europe if you go to athleticgreens.com/Tina. Just wanted to quickly throw that out there. They have not told me to say this in any way. This is just, I genuinely believe in it. And again, the show notes today are tinamuir.com/COVID-19. That's TINAMUIR.com/COVID-19. And there's also the links that Emily mentioned in there as well. Now remember, this time we can use it to unite us, to remind us that we're all human, we're all vulnerable. Every celebrity, every politician, every person in the world is just as at risk of this as anyone else. So this should be a good time to remind ourselves that we're all human, we're all in this together, or we can use it to tear us apart. So let's support one another. Let's keep reaching out. Let's keep checking in. If I can be that person for you, use the contact page on my website. Download the guide, which will again be in the show notes, and do what you can to support other people. Have a great week, my friends. I will see you on Friday.
Thanks for listening to the Running for Real podcast. Be sure to check out tinamuir.com for show notes and even more helpful running information.